Hey everyone, it's Michael here at Home Health Success Academy, and you are in the prospecting video series. And in this video series, we're going to be talking about prospecting and how to be able to know details and be able to find the right people, the right type of potential referral sources that we're going to be able to get. And in this video especially, we're going to talk about research. How to research who are the right people that's going to be able to refer patients to us directly. Now, look, obviously, there are some of the most basic places that we can get referrals. These are your rehab facilities, these are your hospitals, these are your physicians, these are your assisted living facilities, these are your senior centers, the senior day centers, these are your adult living communities, those housing communities that are only allowing people that are 55 and plus and up to be able to live in those particular areas. Now, there's other places that we can also look into. Now, you need to research where you can get these type of referrals. And at the same time other than researching them, you need to be able to figure out who's within reach and within grabs from your facility to make it easier for you to be able to market out there. So let's look at the basics, right? Hospitals. Hospitals are the right places where you need to be able to get referrals. But then when we do our research, we need to start looking at who are the referral sources within the hospitals. Who are the people that we need to be able to target? So in the hospitals, we know it's the discharge planners that are the ones that are referring patients. Other than discharge planners, what are the other names within that industry are the ones that we are going to be targeting? One of them is your social workers. Typically, social workers and discharge planners are one organization or one person or one group of people within that hospital, but some hospitals are different. So we need to be able to research that. How do we find out? Well, we go through LinkedIn. We can also go through the company's website. Sometimes in the hospitals, they have websites and they will actually say who's who. Another thing that you can do is making sure you give a call. Make that cold call. Find out who's who. And if they're not available, find out from the person if they can give your information. Another one that you guys can do is you can walk into the hospitals. They're not going to let you in sometimes, but you can talk to the front office person and they can give you the basic information about these items. You must be able to learn how to research that. Next thing is your skilled nursing facilities. How do you research about a skilled nursing facility? You can go to Medicare.gov and find out about that particular facility. And then what you can do is you can go to a variety of different state websites. Within the state that you're in, whether you're Florida, California, Illinois, you can go into the website who is the organization in charge of approving that particular business, the rehab facility, and most of the time they are able to give you information within that website that's going to be able to let you get information. There's this wonderful website called data.gov that you guys can actually pull a lot of these information out that you can get from Medicare.gov, and it's in an Excel spreadsheet with detailed information. Now, within those websites, within the state that you're in, you can get the bed count, what type of insurances they're actually accepting, how much Medicare patients they have, what are the names of the administrators, and then from then on, when you have those names, when you are researching, find out who is the DON, the Director of Nursing, find out the name of the administrator, find out the name of the ADON, the Assistant Director of Nursing, find out the manager for the physical therapy within the company, find out who the discharge social worker is, find out everything that you guys can do. The reason why we prospect is this is the research portion before we attack a particular facility. On a assisted living facility, find out who the administrator is. Do they actually have a nursing supervisor or a nurse in charge in the facility as well? Because just because it's a non-medical, it's an assisted living facility, it does not mean that they don't hire nurses to be able to make sure that they give out the medications. So these are things that you need to be able to research. Find out who their marketer is, who their sales representative is, because this person could be a gateway for you to be able to jump into these things. Good information regarding prospecting. The next thing is also, let's say we're targeting physicians. What are the name of the physicians within that group? Do they have a website? Is that something that you guys can actually do? Look into that stuff, right? There's a variety of different things that we must do when we prospect to be able to find out where else we can find referrals. Those 55 plus communities, right? Who are the who's the head of the association? Who's the president of the associations there? Are they having organizations within the community, within that community alone? Who do you need to be able to get? You need to ask yourself, who do I need to target within these communities that's going to get me an in to make it easier for me? What are other places that you guys can get referrals? Well, you can go ahead and look for financial planners. Financial planners, they work with a lot of seniors, right, to plan their financial future, the remaining part of their lives. So this is something that you guys can actually work with. Are you going through a lot of associations? Are you joining the Alzheimer's Association? Are you joining the Parkinson's Association? Are you joining the local diabetes associations out there? Why? This is a way to be able to get you guys in within these communities. You need to be able to start prospecting in order to be able to get more clients. And so the research is one of the most important things. Now, here's a quick technique. There's this amazing website where you can get all the information that you want from these referral sources. It is called www.google.com. That's right, Google. You can Google these informations to be able to get the information that you guys want. You are able to do a research in google.com to be able to find out pretty much everything you need to know about this. And that is how important this is so for you, is researching rather than just, jumping into the mix and just playing along and just say, you're playing what they call the hope game. I'm hoping I find a rich referral source that's going to be able to give me all the patients that I want. You have to understand that if 50% of your company's referral is coming from one facility, from one person, you are one great, amazing marketer away from losing half of your business. You must have multiple flows of referrals coming from different people and not just relying on one source. This is something that you have to do. You should start researching. A lot of great information out there. Medicare.gov is great to be able to look into. Google is good to look into. And within each organization is something that you need to be able to determine. So what you guys have to do is you need to make sure that you guys do a lot of research in order to be able to make your process, your sales cycle, your sales process more successful. So research, 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 and that is what's gonna get you guys an upper hand from the other agencies. Most agencies are not spending time researching on who they want to target. They're wasting time on how to take care of the current patients that they have. And they're not even researching how they can make sure they keep the current referral sources that they have. And that's why when they lose a referral source, that's when they actually have problems that happens. So remember, this is Michael with Home Health Success Academy. This is our prospecting series, and you should definitely take advantage of this and start learning how to be able to research correctly about these people that's going to be referring patients to you. Hey everyone, we want to be able to invite you to our 10xpatientreferrals.com, where we have our online home health marketing academy that's going to be able to help either a home health, home care, or hospice agency increase referrals, increase their census, and create a profitable company. Now, at this very moment, you're going to have access to these information through these training, marketing to physicians, how to get to hospitals, how to be able to get into nursing homes, and much, much more at a month-to-month basis with no contracts needed. It's just month to month. Now, guess what? We are offering you guys for a limited time 50% off any one of our plans. Just choose which one is going to be able to work better for you. So just stop by the 10xpatientreferrals.com at any given moment. So these are the plans that are available, whether it's the gold, the silver, or the platinum plan. Most people go for the gold plan, but it's up to you what's going to work for you. We definitely want to be able to have you come in and work with us. So here's two choices. Go to 10xpatientreferrals.com or click the link down below. Take advantage of this right now at this very moment and sign up with us. We would like to thank our sponsors of this video. And over here at 10xpatientreferrals.com, our goal is to provide you guys amazing information on every single one of our videos. So medicationreminderprogram.com provides daily medication reminders for your patients. They call your patients twice a day to remind them to take their medications. What happens is a top reason of hospitalization for senior citizens is not taking their medications. So this program allows you to be able to keep your patients and not lose any revenue, but at the very same time, it allows you to stand out when you are marketing to other referral sources because you're providing more services, more programs than the competition around you guys. The next thing we want to be able to share with you guys is they have 3 different packages available for you at this very moment. Choose which one works for you. If you're an agency that's just starting up and you have less than 10 patients, you can go with the silver plan. Or if you have 50 patients, you can go with the gold plan. Or if you have up to 100 patients, it is only the choice to use the platinum plan. But guess what? It's up to you which one works for you guys. For a cost of as little as 33 cents per patient a day, it is worth everything for you guys. The next thing is homecareansweringservice.com. It's an answering services for your agency. So if you want to be able to have us handle all the calls for you in the weekends or the off hours when your business office is closed, we can definitely do that. Or we can even answer your calls for you during the day as well. Allows you to be able to do everything for your company. So homecareansweringservice.com is your solution for answering your calls on a timely manner. Now, before we continue on to the video, just need to be able to take a few seconds of your time. And so we want to be able to ask you a question. Are you looking to gain more referrals for your agency, your home health, your home care, your hospice agency? We want you to be able to join us at our Online Marketing Bootcamp that has over 7.5 hours of training. When you actually watch our bootcamp and join our Online Marketing Bootcamp training, so sign up for a limited time at 10xpatientreferrals.com